Smoking didn't used to be related to health much at all. Back into the 1940s and 50s, smoking actually used to be touted as having possibly good health benefits. It wasn't until in the 1950s that doctors started looking at possible adverse effect of smoking by seeing a link between lung cancer and smoking. And later on, it became obvious that smoking has very large adverse effects on health, including lung cancer and so on. And in the 1950s and 60s, that became more apparent. And it was actually maybe about 10 years after the studies linking smoking and lung cancer that people started looking at the effect of smoking and multiple sclerosis, and tried to look at whether smoking could even cause multiple sclerosis. And those studies quickly showed that there wasn't any link between smoking causing multiple sclerosis. But later on, people started looking at whether smoking could worsen multiple sclerosis. And those studies were sort of showing effects both ways. There were some studies showing no effects on multiple sclerosis progression, and some showing that there were adverse effects making multiple sclerosis progress more rapidly. Until about 10 years ago, there was mounting evidence that smoking would actually make MS progress faster. People who were having initial signs of MS or were what we call clinically isolated syndrome would eventually develop multiple sclerosis, and evidence like that was coming up. One thing that we didn't know, one, was that most of these studies were epidemiological studies, and we didn't know what exactly was the effect of smoking on brain volume, whether it was having any adverse effect on brain volume itself. The other thing was that we didn't know whether quitting smoking would have any benefit. Whether we knew that smoking was bad, but we didn't know whether cessation of smoking would actually help the patients. So that sort of prompted this study. And in this study, we retrospectively looked at patients who had been smoking, and we compared those to the patient who had also been smoking but stopped smoking on their own. And we compared the brain volumes of these two groups of patients. We saw that while patients were smoking, both groups of patients showed that the brain volume was basically shrinking over a period of time. We followed these both group of patients for about 4 years, and we saw that their brain volume was decreasing at a rate of about 0.5% every year. Now, patients who stopped smoking, we saw that in them, the rate of brain volume change actually decelerated from that 0.5 percentage point a year to about 1/3 percentage point a year. So they basically halved the rate of brain deceleration, which we think is a very remarkable change. Now, the importance of this is basically that it gives the physician and the patient a motivation to talk about stopping smoking in patients who are smoking. It gives them another tool, another motivation tool to basically quit smoking.